So thank you and good evening, everybody. Firstly, I am so sorry I can't be there in person tonight. I'm sure you're all going to have a super evening and I'm really sad to be missing it. But this evening, I would like to present to you some work from new systematic reviews. So thank you very much for inviting me to speak this evening. I'm truly delighted to share these summaries with you. And we're going to look at the effectiveness of oral nutritional supplements, one in paediatrics and one in adults. So let's make a start. First, we'll look at the review in adults. This review was published earlier this year and shows that the use of ONS in the community for around 3 months in a range of patient types can lead to a clinically and meaningful reduction in complications that is statistically significant. And this review very much adds to the evidence base we already have for oral nutritional supplements and re-emphasises the important need to identify and manage malnutrition effectively, as this really does lead to clinical benefits for our patients with a wider economic impact. So now let's turn our attention to the review itself. So we set out to critically and systematically review the impact of all types of oral nutritional supplements consumed in community settings used in all patient types on complications. And I'll give you a little bit more details now about what that really means. So the studies that were eligible for inclusion in this review had to match our predetermined inclusion and exclusion criteria. So it could include adults with disease. They could have any type of nutritional status, so they could be malnourished or well-nourished or a mix of both. They were randomised to receive intervention in the community setting. And now what we define as community setting in this review could include own home, care home, outpatients, GP surgeries, district nursing, rehab and community hospitals. It could also include community studies that did have a hospital admission as part of the study, such as if the intervention was taken preoperatively before they went into hospital or post-discharge following, obviously, a hospital admission. All the papers had to be randomised controlled trials and they all had to be full papers, so abstracts are actually excluded. And the ONS had to be a multi-nutrient oral nutritional supplement. It could be powdered or ready to drink, and it had to contain more than one macronutrient, and it was versus a control arm. And now that control arm could be placebo, it could be dietary advice, routine care, or standard diet. Now, I said we looked at complications. In this review, that included complications such as infections, falls and post-operative complications. These were all eligible for inclusion. Minor adverse events or non-specific symptoms that weren't related to the intervention were actually excluded as part of this review. So now if we move on, so not a small amount of work, because in total there was over 55,000 studies identified with our inclusion-exclusion criteria, and nearly 40,000 were excluded in our initial screening. And we actually assessed the full text on 842 studies, but we found 44 were eligible. So 44 randomised controlled trials were included in this systematic review. You'll also see as we go through the presentation that we include some meta-analysis as part of this. 41 were eligible for meta-analysis. So across these 44 trials that were included, just a quick overview of the types of individuals that were involved. The mean age of the patients was 67 years. 64% of them resided in the community only. 34% had intervention across the hospital and community setting. And we had a range of both surgical and medical patients, as you would expect. So in terms of the oral nutritional supplements, the mean energy density was 1.5 kcal per mil, and the mean percent energy from protein was actually 22%. So a lot of the studies, half of them used a high protein oral nutritional supplement. Overall, the mean prescribed intake was 588 calories, with more of the studies using ready-to-drink formats, 86% over powdered. Compliance was good at around 77%, And the intervention period was around 3 months, so 74 days, but it did range from as little as 5 days right up to a year. So we'll now turn our attention to some of the key results that we found in this review. So this slide shows an overall reduction in patients with complications when they're taking the oral nutritional supplements. It shows a summary of the pooled data based on 39 randomized controlled trials that were part of the meta-analysis that we undertook in this review. So overall, what this is showing us that in patients who were randomized to receive oral nutritional supplements, there were 523 patients who had one or more complication out of a total of 2,569. So that's 20% of patients who received ONS had complications. To the right-hand side circle, in those that are randomized to the control arm in all of the studies that we reviewed, 708 patients had one or more complication out of a total of 2,616. So 27% of patients who received control had complications. So actually, if we think about this as a whole, this equates to a 26% reduction in complications with oral nutritional supplements. Now, this is just the data as we see it, but we then went on, as I mentioned, to meta-analyze this data, which is not this doesn't only consider this absolute number of patients which we're showing here, but it's also able to take into account the size of the trial and the heterogeneity of the data that we're looking at. So I apologise in advance for this really busy slide, but I did just want to share with you the actual plot that we see as part of meta-analysis. So just to orientate you all, on the left of this slide, you can see the forest plot, which includes the data from each individual study of the 39 studies that were involved. And the statistics are shown for each study as well. And this includes the odds ratio, 95% confidence interval, the p-value for each study, and the individual study data on complications. The summary diamond for the pooled analysis, hopefully you can see it. I've put a little red square on it at the bottom of the slide. And this is less than 1. And what it's telling us is that it favours the intervention. So overall, the pooled analysis shows us that the odds ratio of all of these trials together is 0.68. And this is highly significant. And if we consider this odds ratio, we can actually say there is a 32% reduction in complications with ONS. So we then actually looked at some sub-analyses as well, and I won't go through all of these on the slide, but in essence, what I want you to take away from this slide is that we see a significant reduction in complications with oral nutritional supplements, which remains significant independent of age, whether they're less than or greater than 65 years, whether their nutritional status is malnourished or mixed, and whether they are in the community or the community and a hospital setting, and even whether there are surgical or medical patients. We also did look at the high protein supplements because I mentioned quite a high majority of the studies included in the systematic review used a high protein or nutritional supplement. And we also found that this significant reduction in complications was also shown with the high protein ONS. So I was also keen to start to understand the effect in certain patient groups as well. And it wasn't a focus of this particular publication that which we're discussing at the moment, but I did undertake some secondary analysis of the data. And the first group I have looked at is oncology patients. And as I mentioned, although it's not part of this review, I did recently present this work at ESPEN this year. So I thought I would just quickly take the opportunity to also show you that data very briefly. What you can see here is that when we look at this one group of patients, oncology patients, there were 17 randomized controlled trials that were eligible for analysis. All the same inclusion and exclusion criteria still apply. Overall, the mean age was 63 years in this group of patients, and the range was 47 to 70 years. And again, they had varying nutritional status. Just for context, the supplements were given preoperatively in 9 of the trials, postoperatively and post-discharge in 5, preoperatively, postoperatively and post-discharge in 3, and in the community only in 3. So you can see how we're starting to look at different ways we might look at our clinical practice now with new protocols that may be in place for the management, particularly in oncology patients. The majority of the supplements were ready to drink, 72%, and the mean intake was a little higher than what we'd just previously seen in all patient types, nearly 700 calories per day. Again, half of them were high protein, and also a third of them were enriched with omega-3s as well. So what you can see here from this forest plot on the slide is that, again, ONS significantly reduced complications versus control. So the odds ratio is 0.64. And again, you can see the little diamond in the red box there is to the left of 1 and is favouring the intervention. So favours the oral nutritional supplements with a 36% reduction in complications with ONS. So that deviates a little bit from the main systematic review, but I just wanted to share that with you in terms of specific patient type. So we'll now go back to the main systematic review. So I guess working in clinical practice, as I know many of you will be doing, we know that compliance is one of the really key things to seeing the benefits of oral nutritional supplement. And as part of this systematic review, we were actually able to show the effect of both compliance and format on complications. So, for example, we showed the reduction in complications with oral nutritional supplements was only significant in those studies where patients consumed 80% or more of the prescribed volume. And in those studies that used the ready-to-drink format, so the ready-to-drink liquid products. So on the left-hand side of this slide, you can see there the significant reduction in complications in this subset that had really good compliance and used the ready-to-drink products. If we look at the data to the right-hand side of the slides, what we see here is that it is not significant in the individuals who were taking less than 80% of their prescribed volume, and also in those that were given powdered supplements. Although, you know, of note, this is a much smaller number of trials. So I think this is a really interesting finding, and the first time we've been really able to see these differences in significant and non-significant outcomes when we consider compliance and format. So I just, again, want to take a moment to think about and have a slightly deeper dive into these two aspects. So if we think about compliance, firstly, I guess, just to summarise, we know from evidence that generally compliance to ONS is good. I'm not sure everyone believes that, but what the data tells us is that it is good. So the right-hand side graph here are results from a systematic review that was undertaken in 2012 now, and it found that compliance generally is good, so over 75%, but actually compliance gets better with the higher energy density oral nutritional supplements. So here you see the significant improvement in compliance up to 92% if you're taking a supplement with more than 2 kcal per mil. We also have shown in the table, in the graph on the left-hand side, that when you look over the short term and the longer term, compliance is greater with a lower volume ONS. So when you think about 125 ml versus 200 ml, and you can see that again here in the graph on the left. So what's really key and one of interest to me in any research that we undertake, we always look to assess compliance. I think it's a really good thing to check if you're considering doing any formal assessments like this. So just in this last little box on the bottom here, in a pragmatic service evaluation that we undertook, where we were actually looking to implement malnutrition screening and management according to risk in the community, led by a dietitian, we found compliance to ONS was actually good, 90%. And this was when we were using a low volume, high energy density supplement for those patients at high risk of malnutrition. Similarly, in a randomized control trial that we undertook in general practice in over 300 patients, we also found that compliance to these low volume, high energy density oral nutritional supplements is really good at 83%. Now, in the systematic review we're presenting today, we also talked about format. So just to share with you some work we've also done in terms of format. This is just some simple surveys of preference across patients who've been prescribed both ready to drink and powdered supplements. So the graph on the left shows us that patients significantly preferred the ready to drink supplements versus the powdered supplements. And on the right-hand side graph, you can see that the patients reported that the ready-to-drink ONS, they found them more convenient, with a better consistency. They were easier to use and easier to prepare. I guess we all know this in practice, but it was interesting to see this from the patient's perspective. And all those results that you see across these two graphs here are significant differences. So I guess if we just come to conclude from this systematic review, so based on this review in adults, we found that oral nutritional supplements used in the community, in addition to normal diet, significantly reduces complications compared to control. And I guess just to think about that, this data is with supplements around 600 calories for taken for around 3 months. And this is across this range of patient groups, as I mentioned. We also have shown that this reduction is only significant when compliance is good, so 80% or greater. And it was also only significant in those where ready-to-drink formats of all nutritional supplements were consumed. These reductions, as I mentioned, were also have been seen the same whether the patients were older or younger and independent of nutritional status. And we were also able to show that these high protein supplements significantly reduce complications. And we obviously popped out and had a quick look at the data we presented at ESPEN to show it's a similar reduction in a subset of oncology patients. So hopefully that's given you a really quick overview to the review we've written in adults, specifically looking at the outcome of complications.